again. In the previous videos, we discussed why problem definition is the first and most important step in policy analysis and program planning. We also mentioned the two components of problem definition and described the first component, formulating the problem statement. In this video, we will talk about the second component of problem definition, which is constructing the problem model. Remember that problem definition has two components. Now we are focusing on the actual problem model. Defining and quantifying the problem, like we did in the first step, is not enough. We need to build a problem theory that actually clarifies our understanding of the biopsychosocial processes that produce social and health problems. A problem model, then, is a portrayal of the factors, either individual and environmental, that give rise to a problem or sustain that problem over time. Think of a problem model as a simplified version of our understanding of the factors that cause or sustain a problem we will address with our policy or our program, and the consequences of inaction. The problem model is also important because it will clarify the causal logic of an intervention and will describe how the intervention activities are expected to produce significant effects to ameliorate a problem. Right? So the problem model not only depicts our understanding of the problem, but also shows a causal chain that describes how the interventions are going to address this problem. The problem model has three components. It has the contributing factors, the problem statement, and the consequences. It helps to do your problem model or to summarize your problem model in a graphic where you have the problem statement in the middle, you have the contributing factors to one side, usually the left side, that are contributing to that problem, and then the consequences of inaction. What happens when we do not solve the problem or when we do not address the problem? Let me give you an example. Here we have in the center a problem statement. Too many Monterey County students drop out of college. Right? When we were formulating the problem statement, we had to quantify the problem. We have found that there's many students that are actually beginning college but not finishing it. Now, there may be many reasons for why this is happening. We have some contributing factors on the left. These are some of the reasons. So, many of these students graduate high school with inadequate math proficiency, and they cannot catch up in college, and that's why they may end up dropping. Another contributing factor may be the cost of living in Monterey versus the cost of college. It costs too much to live here and go to college when you have to work 2 or 3 jobs to sustain yourself, to finish it. Some may not have access to financial aid, and that contributes to them dropping from college. Or maybe they run into problems with advising. They lack adequate advising, and they make poor decisions that lead them in a path that doesn't allow them to finish their desired degree. Now, if we let this go on, if too many students drop out of college and cannot get bachelor's or associate's degrees, then the consequence of that is having an uneducated local workforce and having pockets of lower income in our community, which is what would happen if too many students don't finish college and are stuck with student debt. So let's start looking at the components of a problem model. The most important of them are the contributing factors. And these factors can be risk factors or protective factors. Risk factors are conditions that, when present, are associated with a higher probability of being affected by the problem. Right? Protective factors are conditions that are associated with a lower probability of being affected by the problem. Contributing factors are a crucial part of the problem model because they facilitate the identification of leverage points of intervention. They let us know what we can address to actually have an impact on the problem. Your contributing factors that you will include in the model come, of course, from research. They come from a literature review, an advisory board, interviews with key informants, right? Only through your extensive research on the problem can you find what is causing that problem. What does the literature say about that problem? And also through your advisory board and your key informants, you may find out what is causing that problem in that specific locality or that specific place where your program is going to be um, introduced, right? Now, you do not need to include an exhaustive list of factors that impact a problem, right? If you have let's say, a problem of college dropout rate, there may be thousands of reasons why an individual or a group of individuals may end up dropping. You do not need to focus on all of them. You just need to look for leverage points that can be targeted by interventions at the level your program is going to be operating. What does that mean? And for that, let me give you an example. Let's say we have a problem of the child obesity rate in Monterey County is too high. Right? Last time I checked, about a third of children in Monterey County were overweight or obese. That is a problem. Now, what are some contributing factors for that? Right? Maybe we have structural poverty. Maybe we have some authors suggest that the structure of food production and commercialization in the United States is a contributing factor to childhood obesity. Or parental literacy level. In this case, parental literacy is a protective factor. The more literacy, the less likely to have obesity. Poverty is a risk factor. If poverty is present, the risk increases for childhood obesity. But let's look at these contributing factors. If we are enacting a program or a policy at the local level, at the county level, can we really address poverty? Can we change the structure of food production, the capitalist system that we have of food production in the United States? Or can we really change parental literacy when they already had children? Can we really change that realistically with our program? Well, probably not. Chances are not. With a project or a program that is going to be operating at the local level, we're probably not going to affect or change any of these contributing factors in the medium term, at least, or the short term or the medium term. So maybe we can focus on other contributing factors to this problem that we can address, maybe more individual level, like lack of physical activity. That is a contributing factor. It's a risk factor for childhood obesity. Lack of access to healthy fresh food, that is a risk factor as well. Or easy access to unhealthy snacks at school, that is also a risk factor. Now, this one we may be able to affect at a local level. Now, these are contributing factors like the other ones, but the other ones we probably cannot affect at the scope our program is operating. These ones we may. So we can choose this in our problem model. Remember that problem model, any model for that matter, is a simplified version of reality. In this case, we are choosing three causes, or three, contributing factors that we can actually address, that we can use as leverage points to have an impact on the problem. The other three that we discussed before, we wouldn't have been able to with our program. So, to summarize, these contributing factors are the result of a research process that includes a thorough literature review, consultations with experts, conversations with local key informants. But it's also based on decisions of which contributing factors may be relevant for the scope of the program or policy we are planning. Now let's talk about another component of the problem model, which are the consequences. Consequences are conditions that result from not addressing the problem. Now, I should say that some authors do not include consequences in their problem models. Some of them don't even talk about consequences in a problem model. I think they are very important. I disagree with authors who exclude them from problem models because they help to justify the interventions. And if you remember the first video when we were talking about the importance of problem, one of the reasons why problem definition is so important, we said because it helps people understand and buy into solutions if they understand the consequences of the problem, right? So if people understand the problem and its consequences, it's easier to mobilize them to support the policy or the program. Let's go back to our example on childhood obesity. If the problem is childhood obesity rate, what happens with people who don't have children? Right? Maybe they won't care about this problem as much. Right? If you have adult children, people may not care about this that much. But one of the consequences of this problem affects everybody in the terms of high healthcare costs in the future because of high rates of chronic disease, like diabetes, for example. So, while it may not affect me directly that a child is obese, it affects me indirectly because it has consequences for everybody that are translated into higher healthcare costs. If we include the consequences in the problem model, it's easier for us to gain support for a problem that maybe some people don't care about. That's why including the consequences is an important part of this. Now, the consequences also come from doing research on a problem. In summary, the problem model is a simplified version of our understanding of the factors that cause or sustain a problem we will address with our policy or program and the consequences of inaction. The problem model clarifies the causal logic of an intervention and describes how the intervention's activities are expected to produce significant effects on the problem. The problem model includes contributing factors, which can be protective factors or risk factors that we can target through interventions to reduce the problem, and includes the consequences of inaction. And these are conditions that arise as a result of maintaining the status quo. Now, always remember that the problem model is the result of a research process. It is not your opinion. It is a result of a research process that includes a thorough literature review, scientific literature that is, or technical literature, consultations with experts, conversations with local key informants. That concludes our discussion on the problem model and concludes our entire discussion on problem definition. By now, you should have an understanding of the reasons why problem definition is the first and most important step in program planning and policy analysis. You should know the components of problem definition. You should know about the steps and the guidelines for formulating a problem statement. You should know the process for constructing a problem model. I hope you enjoy these videos. I will see you soon.